Should you get an enhanced silver plan if it's offered to you? Let's find out. Hi, I'm Kevin Knaus with InsureMeKevin.com. And with the American Rescue Plan, many of the subsidies are larger for people in covered California. This means that some people who were paying maybe $50 or $100 for a bronze plan find that to be $1, and potentially a silver plan is as low as $1 depending on their income. And they are now being offered an enhanced silver plan, 94, 87, or 73 at a very low price. But what are these enhanced silver plans, and are they right for you? Well, an enhanced silver plan has reduced cost-sharing reductions, but you cannot apply for one. They are awarded to you and your family based on the household income. So there's different levels there. You can see a silver 94 goes up to 150% of the federal poverty level. And then on the upper end of the spectrum, you can become eligible for a silver 73 if your income is 250% of the federal poverty level for the household size. So that can be very important, but what are these numbers? Because you see the 60, the bronze 60, and silver 70, and gold 80. Those numbers are very important in the health insurance field. And what they represent is an actuarial value. In layman's terms, what they have determined that if you have a bronze 60, 60% of the healthcare costs for the average person in that plan, in that pool, in that region of California, 60% of the healthcare costs will be covered by the health plan. If you have a gold 80, then 80% of your healthcare costs will be covered. And so you can see silver 70, 70%, platinum 90, 90%. Now that may not always apply to you because every individual is unique. For instance, let's say you have a bronze 60 plan and something major and catastrophic happens to you and the bills are $100,000. With a bronze plan, you are only on the hook for the maximum out-of-pocket of $8,200 with in-network providers. So if you paid a total of $8,200 against a $100,000 total healthcare services, that means that 91.8% of your healthcare expenses were covered. Much better than 60%. Conversely, if you maybe had a minor outpatient surgery and you didn't even meet your deductible of the bronze plan, then you would have had a whole bunch less coverage from that bronze plan. So the enhanced silver plans, 73, 87, and 94, represent the average healthcare costs that will be covered for the average health insurance consumer. So a silver 87 is better than a gold plan, which is 80, and a silver 94 is better than a platinum plan. Of course, the monthly rates may still be more for these plans than a bronze 60 plan, because you may have many different options where you live, and some of the health plans are more expensive. For instance, the Health Net and Blue Shield PPO plans are much more expensive. They usually have a wider network of doctors, and that elevates the cost. But we need to kind of really look at these enhanced silver plans because there are some really good points to them. So on the individual maximum out of pocket, there are family numbers as well, but I'm just going to focus on the individual. You'll note that the bronze 60, the silver 70, and the gold 80 all have the same maximum out of pocket of $8,200. Platinum comes in at $4,500. Platinum plans are expensive. Now there are deductibles with these plans. On the silver 70, that $4,000 deductible usually only comes into play if you are hospitalized or in a skilled nursing facility. But you can see that the out-of-pocket maximum drops with a silver 73 at $6,500, $2,850 for the Silver 87 and just $1,000 for the Silver 94. And then also the deductible drops, but sometimes many people don't even use the medical deductible because many of the Silver plans have a co-payment for routine services. So an office visit, a specialist, urgent care, emergency room, labs, tests, x-rays, diagnostics, those all have a set copay. They are not subject to the medical deductible. And as the Silver plan goes up from 70 to 94, those copays decrease. Sometimes very dramatically and obviously much lower than a gold or a platinum. Now, one of the things you need to remember about the bronze plan, it's $1. You're only getting 3 cumulative office visits at $65 to $95. That means 1 office visit, 1 visit to a specialist, and 1 urgent care visit, and you're done. Or in any combination, but you're only getting 3 of those visits. Labs are $40. Everything else is subject to the medical deductible of $6,300. So you have to meet $6,300, then you go into co-insurance. That next dollar over $6,300, $6,301, you pay 40%, the health plan pays 60%. And then when all of those little co-pays, the deductible and the co-insurance equals $8,200, then the health plan covers everything for the year. But with the Silver plans, many of those routine services just have a set copay, so you can go see your favorite doctor as much as you like. But potentially, you have a health challenge that requires a lot of tests. And so that's where the Silver plans and the enhanced Silver plans can really help out. There are prescription drug coverage with the Silver plans up to the gold and platinum. Bronze doesn't really have any prescription drug coverage. So, but of course, if you're not taking prescription drugs and you're being offered a bronze plan for $1 or very low, then it's very, very enticing. But we have to remember the maximum out-of-pocket and deductible if you think it's going to apply. Now let's look at an individual that is 57 years old with an income of $30,000 that lives in Nevada County. I just ran this quote a couple days ago. And there aren't a lot of options in Nevada County. You just essentially it's Blue Cross, EPO, or Blue Shield, PPO. With the increased subsidies from the American Rescue Plan, they can get a Silver 73 for $1. They can get a bronze Blue Cross for $1 as well. Now, the big difference between the Blue Cross and the Blue Shield are the providers. Blue Shield has Sutter, so if you are seeing Sutter doctors, you may want to, invest in that particular health plan. And it's $85.11 for this particular individual for a Silver 73. So that's pretty good. I would definitely recommend taking that over the gold or the platinum, just on the basis of the lower deductible and maximum out-of-pocket. However, the rates and the savings, they can vary depending how many plans are in the region, your age, your income. On this particular scenario, the individual is 24 years old, only making $25,000, and they lived in San Mateo County. Now, they actually qualified for a Silver 87. It wasn't $1. The subsidies are based on the cost of the second lowest cost Silver plan, and the Oscar plan was relatively very competitive, relatively low in terms of the rate. So the subsidy isn't that big. So Kaiser Silver 87, $11 over a Kaiser Bronze 60 at $1. Definitely, if you're a Kaiser person, you would want the Silver 87. But then you need to, look at as those costs go up, is the value of the enhanced Silver plan greater than the Bronze 60? Of course, if you have any health challenges or you anticipate going to see a doctor on a regular basis to manage a health condition, you want a Silver plan. But just from the maximum out-of-pocket and the deductible alone, even if you're paying $100 per month for a full year, that is still less than the savings from the reduced maximum out of pocket and the deductible, even on a Silver 73. But of course, dollars are dollars, and once they're out the door, you can't get them back. And if you don't have any healthcare emergencies or services, then some people consider it wasted money. We do need to think about health insurance for some people as asset protection. You're protecting your assets. So the enhanced silver plans lower your liability. For like car insurance and home insurance, how much do you have to pay out of pocket if your home burns down or if your car is totaled? And the enhanced silver plans reduce your liability without necessarily increasing the cost within the silver range, because actually the premium rates for all the silver plans, regardless whether it's a 70 or 94, are exactly the same. The rates seem lower to you because as your income goes down, the subsidy goes up. But the rates are exactly the same. It's just the cost sharing that is different, and it's being passed along by the health plans. That's another topic altogether. But they can be much better than a gold plan. You'd be much better off in terms of asset protection taking a Silver 73 over a gold plan if you're never going to use it, just because the liability within the Silver 73 is smaller than the gold. So hopefully that kind of helps you think about this a little bit. I did not touch on high deductible health plans, the HSA compatible plans. That's kind of a different beast. If you have an HSA, you're using the HSA, then maybe you want to stick with it. But if you don't have one, starting from scratch, it's a big cost and it can be a big shock. So, and I was just focusing on the enhanced silver plans. But if you have questions, go ahead and leave comments down below. You can give me a call. You can send me an email. I'm Kevin Knaus with InsureMeKevin.com, and you have a great day. Take care.